While the slides load, I'd like to take the opportunity to thank the organizers of this conference, Dr. Lalta and team, for convening us all here in beautiful Antigua and Barbuda. When we were flying over the day before yesterday, I mean, I was just blown away by how beautiful the country is, the coastline and the mountains. And for those of you that are familiar with the Bahamas, we don't have these mountains. So it was a sight of beauty, something to behold. And then we come here and we meet the people of Antigua and Barbuda, and you're so warm and welcoming, and you're truly a gem in the Caribbean islands. So thank you so much for having us. I have the awesome task of talking about the National Health Insurance Program in the Bahamas. And I'd like to start by saying that this is a journey. I think it was Dr. Sure. Got you. Thank you. I think it was the doctor from Belize that says, think of this as a marathon. If any country is endeavoring to implement universal health coverage and you're thinking that this is a sprint, you're going to be in trouble. The Bahamas started its journey to universal health coverage 40 years ago. And I'm going to tell you in a few minutes about the launch of NHI and where we are today. But I just want to reinforce that as a collective, we have so many shared experiences. We have so many challenges that are shared among our Caribbean nations. And I'd like to think of us as a hand. If you look at your hand, I know it's after lunch, guys, try and engage as much as I can, right? But think of your hand. Think of all of your fingers, all right? Your thumb is important for direction and movement. Index, right? Your middle finger, your ring finger, your pinky, all of these have unique functionality. But when you put those fingers together and you form a fist, you ball a fist, you could strike a mighty blow. We are all fingers in the Caribbean. Until we start to see ourselves as this fist, we're always going to come up short. Until we move out of our silos and islands. We have silos in our own countries, we know that. But until we start to see the potential of what we can achieve together, we're going to be running these individual races. So I'd like you to think about that as we talk about universal health coverage. I've heard some excellent information from my colleagues around the region on some things that you're doing. So I get today to share the Bahamian perspective. So again, I'm Christy Butler. I'm Manager and Chief Executive Officer of the National Health Insurance Authority. So today's objectives, what are we hoping to accomplish? We want to give you an overview of the National Health Insurance Authority. What is NHI Bahamas? What do we stand for? What have we been tasked to achieve? And then secondly, program status and achievements. We want to give you an idea of where we are in our journey to universal health coverage. NHI as a health financer. What models are we using to finance universal health coverage in the country? And then the primary care transformation initiative as our next step to universal health coverage. And then lastly, future plans for the NHI program. Forgive me. Okay, there we go. What is NHI Bahamas? So the National Health Insurance Authority is an agency of the government of the Bahamas, launched in 2017. But remember, I opened up with, it's been 40 years since we've been on this journey. So in 2017, we were able to launch the first iteration of the National Health Insurance Program, where we offered primary care benefits to citizens and residents in the Commonwealth of the Bahamas. And we have a very big and lofty task. We're transforming the healthcare system. So we don't just see ourselves as a health insurer, as a health financer, but we see ourselves as a driver of innovation and quality within the healthcare landscape. And we have some very simple tasks. We need to be able to provide access. And I say that tongue in cheek because when I show you a picture of the archipelago of the Bahamas, access is not easy. We need to make sure that it's affordable and equitable throughout our country. And so every decision that we're making is in pursuit of achieving universal health coverage within the country. And we have three pillars that we are endeavoring to achieve. One, we have to improve standards and quality of care. It does not make sense to invest healthcare financing into areas where you're not getting return on investment. You're not raising the standards and you're not seeing the quality of care. We all talked about the prevalence of non-communicable diseases throughout the Caribbean. The Bahamas is no different. And so we have to, as a funder of resources, be able to improve standards of care and see better all outcomes. We also have to integrate the primary care system. We've talked for the last 2 days about how important primary care is as the foundation and building blocks for universal health coverage. You have fragmented and siloed primary healthcare system, it becomes even more challenging to grow to universal health coverage. And then lastly, our ultimate goal, everything we're pursuing allows us to get closer and closer of that overall goal of ensuring that all Bahamians have access to universal health coverage. So NHI's visions and priorities, what do we see as the hallmarks of the success of NHI? First, we have to have enrollment growth. So NHI started with recognizing if you're going to have a successful UHC program, you have to have critical mass. You have to have sufficient individuals within your country or society that are part of the NHI program. And so we've spent the last 5.5 years really growing our enrollment base all throughout the archipelago of the Bahamas. This allows Bahamians everywhere to have access to primary care services where they may not have before. Second, provide a network expansion. This cannot work without doctors. We have to ensure that we have the appropriately trained and credentialed providers to be a part of the network and constantly expanding that network to various islands in the archipelago. Savings and system integration. You cannot achieve universal health coverage with a fragmented healthcare system. It just won't work. You won't be able to have equitable access. So we have to integrate our system, and it has to be cost efficient. This is just not another way to fund healthcare. This has to be a cost-effective way for us to fund healthcare, and we have to have some cost savings. And then lastly, benefit expansion. We have started with an incremental approach to our benefits package, starting with primary care. We didn't go with the whole hog and offered everything. But as we go from strength to strength, we're learning lessons and adding more benefits. And the reason for that is we want to achieve program sustainability. I don't know about it in any of your countries, but you can't give Bahamians something and then take it back or not be able to sustain it. So we have to grow our benefits package in a way that allows us to be able to incrementally grow and sustain benefits. And then you'll see here on the side of my slide, the archipelago of the Bahamas. And I want you to think about the Bahamas stretching almost 800 miles from north to south. And if you look at all of these islands, the Bahamas has more than 700 islands, keys, and landmarks. This is a huge area for us to be able to cover. So we have a unique challenge and perspective in the Bahamas when we talk about universal health coverage, because we have some real mobility barriers as it relates to providing care. However, the mandate remains the same. Our vision is to achieve that across the archipelago, that there are benefits and access for all Bahamians for us to achieve universal health coverage. So program status and achievements. I've talked about us launching in 2017. We're on this journey to universal health coverage. What have we achieved in that time? Well, we have enrolled more than a quarter of the Bahamian population into the NHI program. The Bahamas has, at last census, over 400,000 individuals living in country. 135,000 of those are enrolled in the National Health Insurance Program. And the program has been popular from inception, but we've seen a 23% year-over-year growth rate. This is really taking off. We saw exponential growth during the COVID-19 pandemic. First time, Bahamians really started to pay attention to their healthcare needs. They saw the benefit of primary care and having a provider-patient relationship available to them. And so we're not chasing beneficiaries anymore. We're now in the position where people are actively engaged and want to be a part of the program. Secondly, we have grown our provider network. We have 139 physicians or providers within our network, and this continues to grow. So think back about that archipelago picture to show you how vast and spread out we are. We have to continuously find opportunities to encourage our providers to operate in more remote locations of our country. And then we have 74 NHI facilities where those 139 providers work out of. And they are located on 6 of those islands within the archipelago. So much has been achieved, but much is still left to do as we think about how vast the country is. And then we routinely survey our beneficiaries. We cannot forget the importance of stakeholder engagement. Your beneficiaries and patients will tell you what you're doing right and what you're doing wrong. And we have maintained high patient satisfaction rates, 90% to be specific. And again, I don't know about you, but to get 90% of Bahamians to agree on something, it lets us know that we're heading in the right direction. Also, we've recognized that you cannot achieve universal health coverage or sustain it if you're not able to integrate both the public and private primary care delivery models in country. And so NHI started out with a network of private providers, and we're now engaging the public sector to ensure that all public clinics in country are a part of the NHI model. And what does that do? That levels up the public sector. Somebody made a really good comment earlier today that when you engage public-private partnerships, when you start to have care delivery done in the private sector, it eases the burden from the public sector. That's absolutely right. But in easing the burden of the public sector, we cannot allow them to continuously fall behind. So NHI, through our credentialing and contracting, also has to carve out a space for the public clinics to allow them to level up. Again, remembering that we are in an archipelago, a lot of areas in our country, the only healthcare services that are available are public clinics. And how do we better equip them to achieve universal health coverage? And then lastly, NHI is a consistent funding model. We have been able to steadily decrease our average cost for beneficiary per year, year over year. Presently, we pay $333 to provide primary care services to our beneficiaries. That includes the benefits that we offer, the administrative costs, and also technology, which I'll talk about in a minute. So this slide really is to show that we feel that we're moving in the right direction. We've made some milestones as it relates to achieving universal health coverage. So NHI, as a key driver, has invested in a digital transformation. We recognized very early that we cannot achieve universal health coverage if we do not have a digital framework for us to be able to build upon. We cannot manage what we cannot measure. That's true for any industry. And healthcare is no different. Universal health coverage is no different. So we had to find a way where we had a technological roadmap for us to be able to roll out our benefits. So in 2019, we launched an electronic health record. And for those of you that are familiar with electronic health records, you know that it's a digital tool for providers. It moves them away from the manual and paper-based records and gives them access to digitized records. It also has value for patients. Inherent in the electronic health record that our providers via contract are mandated to use, it allows patients to book appointments. It allows them to get results and information. It makes the patient a part of the experience. Then it has 46 key clinical performance indicators where we got input from PAHO and other international organizations. And it really looks at population health and the non-communicable diseases, compliance, trends, because we have to be able to make public health decisions informed by data and analytics. And then it has a telehealth functionality. That was a big deal for us in the COVID-19 pandemic. Remember the slide in the islands, almost 800 miles we span. So when we had lockdowns, like almost every other country did, and challenges, telehealth was really a tool for our providers to be able to reach beneficiaries and patients within our family of islands. And we're really pushing it to our providers that this was just not a COVID response or a COVID tool. This helps us to be able to bridge the gap in healthcare. So telehealth is definitely something that we're pushing within the NHI network. And then lastly, advanced analytics and reporting, not just for the National Health Insurance Authority, which is very important, but also for providers. They're able to look at trends and analytics in their practice, and they're able to make business decisions based on that. For us, the importance of the electronic health record and advanced analytics and reporting means that we can clearly articulate where the NHI program needs to grow and expand, where are we deficient, where are there needs that we have to address in the community. So NHI health financing, how have we been able to finance our network of providers? So NHI uses a blend of payment remuneration. We use capitation for our primary care services, which is per patient per month, and that allows us really to be able to forecast costs. It does mean, though, that every time we have a beneficiary enroll in the program, our cost goes up, but we're able to do it in a measured and projected way. We also offer bundles for our maternity and infant care pathways. And so these are incentives for specialized care for a finite period of time based on negotiated rates. And then thirdly, we have fee-for-service encounters for our laboratory services, again, based on negotiated rates. And so we found that using a blend of payment mechanisms allows us to be able to be flexible and meet the needs of both our patients and providers. And so by utilizing those payment mechanisms and elements, by having a digital framework, by offering our patients choice, we have been able to really successfully contain costs of the NHI program. And if you look at this graph, this is to illustrate that when we started looking at data in 2018 and 2019, we were delivering care on average per beneficiary at $353 a year. The following year, we were able to bring that down to 346. The subsequent year, 345. And as I mentioned on one of my opening slides, we're now providing primary care services at an average annual cost of $333. So as we expand and we get more experience, we're able to deliver primary healthcare services at a more cost-efficient rate per beneficiary. So NHI is helping to drive down cost within the healthcare sector while also driving up quality by ensuring that all of the facilities that are part of our network are held to standards via their contracts. So program challenges. None of this is accomplished without challenges, right? We all will find, as I mentioned earlier on this journey to universal health coverage, there will be issues. And the NHI program has experienced some of them that we'd like to share with you as you endeavor on your universal healthcare journeys as well. One is financial sustainability. I think that's a challenge for everyone. Certainly, I've heard that as a theme from the presenters for the last 2 days. The NHI program today, much like Belize, is 100% funded by the Bahamian government, coming out of the consolidated fund, and we get an annual budget, right? As the desire and the need for more services come, we recognize that that is not a sustainable financial model. And so we've explored elements such as the employer mandate, as I've heard a number of countries talk about today, and how do we sustainably find ways to finance NHI, perhaps not just with a single source, but multiple streams or sources to be able to make the program sustainable. And then expanding benefits. Our beneficiaries want more benefits. Our providers want to be able to have a larger market share and offer more benefits. But the second is directly correlated or related to the first. You cannot expand benefits if you're not able to say sustainably how you're going to be able to finance them. And then the next challenge or complexity comes, what do you expand to next? Every specialty and country wants to be included in the NHI program. So we're really going to have to rely on the electronic health record and data to identify for us those areas where NHI needs to expand and include. And then thirdly, political will. The Bahamas has had a period of governments and political changes. The NHI program in its 5 years has been through 3 governments. Think about that. We were launched under an outgoing government. We had 4 years of another one. And then last year, we have a new government. So that really is a challenge for the continuity of a national program because different governments have different agendas. They have different manifestos. And there's also a period of time that you have to allot to bring one government up to speed. And also political will. Will the government champion where we as the visionaries and the executive of the NHI program see that we need to expand to? And then the electronic health record. Although this is a revolutionary tool for us in healthcare and in the National Health Insurance Authority, I will tell you, I have now started to wear my hair jet black to hide the wisdom that working with providers on the EHR has given me. Right? Providers are not a group that if you build it, they will come. Now, they understand the benefits of the electronic health record, but compliance continues to be a challenge. How do you get providers to 100% fully adopt the electronic health record? How do you then get the information that is inherent in the system and make sure that it is usable information that the public can digest? And so, although it has been one of the greatest achievements for us in the National Health Insurance Authority, it also comes with challenges as well. The economic downturn. We were hit with a double whammy. The passage of Hurricane Dorian in 2019, and then COVID-19 in 2020. And that has really hampered our government's ability to fund the National Health Insurance Authority. It has also really caused us to pause on the employer mandate as well, because there really is not an appetite, or it's not palatable to introduce any new taxes at this time. And then COVID-19 needs a box by its own. Right? It is set apart as a challenge towards our progress, because the healthcare sector has been overburdened. They have competing priorities. And so we're now finding ourselves in a period where we're getting back to our original momentum for the National Health Insurance Program. So the Primary Care Transformation Initiative, Dr. Lalta in his wisdom asked us to talk about the National Health Insurance Program, primary care, and beyond. So what's beyond primary care? Well, what's beyond primary care is better primary care. And so that's what the National Health Insurance Authority is focusing on, because although we launched with a suite of primary care benefits, the way our current primary care landscape is in country, it is going to be very difficult to achieve universal health coverage. So we talked a lot about focusing on primary care. We launched with primary care, and now we want to integrate the primary care system. So we start with the patient. NHI is very patient-centered. We want you to imagine what the landscape looks like for a patient in Bahamas trying to access primary care services. And in country, there are a number of routes as to how they can access primary care services. They can be enrolled in the NHI program and have availed to them our suite of benefits. Then also in the public sector, there is the Department of Public Health, the Public Hospitals Authority, all operating clinics and agencies that offer primary care. There are private insurance. 30% of Bahamians have private insurance. And also individuals are self-pay or bear out-of-pocket expenses. So this route looks great, right? Everybody has access. But the challenges here are that they're fragmented. Information is not shared. And so we have a real issue as it relates to primary care. And it would not be responsible for us as an authority to continue to add benefits without looking at the primary care layer. So what's beyond primary care? The Primary Care Transformation Initiative, the integration of the primary healthcare sector in our country, where public and private meets each other. And there are going to be a set of very clear criteria. One, a national network of primary care physicians, all contracted on a capitated basis. It means that we level the playing field for primary care. A revised standard health benefit for all Bahamians, making sure that everybody has access to a fundamental suite of benefits in primary care. Thirdly, private health insurance primary care reform. These are consumer protections for the privately insured in country. It means that insurance policies have to mirror what the NHI program offers so that nobody is left behind. And then lastly, it allows us to have a universal primary care electronic health record. So we want to take that functionality that NHI has rolled out and make sure that it's available for the entire primary care scope in country. So when we look at the Primary Care Transformation Initiative, what's beyond primary care, we see a very streamlined approach to the delivery of primary care. Think about the slide before the last where the individual had all of these routes: inefficient allocation of resources, a disconnected care delivery model, no universal standard of service. This now becomes very clearly delineated in this new model. The patient has two payers or funders for their healthcare services. They have a standard health benefit that everybody in country has access to, and the providers of those services form a cohesive network where there are standards, and we're able to have a connected digital infrastructure, operational excellence and efficiency, and a standard of care in country. So we have strong public support for the PCTI. Like I mentioned before, getting 90% of Bahamians to agree on anything says that we're moving in the right direction. And so with that, we're going to be encouraged to continue to roll out the primary care transformation initiative. The right step at the right time. I would like to say that our wisdom allowed us to know that we needed to do the primary care transformation initiative because COVID was coming, right? And that our healthcare system could not withstand us moving from primary care to high cost care. But we were just lucky. So we started the National Health Insurance Program in 2017 with 20,000 beneficiaries, a decent number of enrollees, and we started with primary care. Our intent was to move to NHI 2.0, a package of high-cost care benefits. However, we realized that in order to move from 1.0 primary care to 2.0 high-cost care, we had to strengthen our primary care system. And so that was the genesis of the Primary Care Transformation Initiative, the phase that we're in today. Expanded coverage under the SHB, we offer primary care physician visits. We're improving and expanding our pediatric and maternity care bundles. We also offer general health, wellness, living advice to beneficiaries. We're adding diagnostic imaging to include x-rays, ECGs, and ultrasounds, expanding our cancer screening programs, and more laboratory tests. And so the standard health benefit through this initiative is strengthened and offers a more comprehensive suite of benefits for primary care. A patient-centered funding model. So I talked about capitation being one of the funding mechanisms or models that NHI is using. And in this, we move away from block funding. And we know how block funding works. What did you spend last year? What do you expect to spend this year? And then you get from the government what something in the middle, right? What they can afford to give you. And so in a lot of instances, it is deficient. But based on a patient-centered funding model, the funding follows the patient. So in our network, a patient has to choose from a number of providers. Once they choose their provider, the funding follows them. And that per patient allocation or capitation funding takes into account a number of elements: the cost of care, registration, but it also has adjustment factors to incentivize providers. So for the elderly, there are adjustment factors for higher capitation rates, for individuals who are living in the family islands or more remote locations to incentivize providers. So PCTI challenges. What are the challenges we see for the primary care transformation initiative? One, change management. How do we get the public sector to adopt this model? We found great success in the private sector, but how do we get sustainable change by bringing the public sector into the NHI network? And we all know that change management is a beast within itself sometimes. Second, political support. I talked about earlier when the program challenges that political support sometimes is difficult when you have successive changes in government. I will say that the NHI program has been very successful because we are an authority and we're governed by a board. We're fortunate enough to have two of our board members with us, our chair and deputy chair, but that really helps to establish NHI as an autonomous authority and allow us to be able to move forward. But political support in any country is important when one is endeavoring to achieve universal health coverage. And then provider buy-in. How do we get providers to agree to these negotiated reimbursement rates? And then also legislative reform. We have had to repeal and replace our current NHI Act or legislation of 2016 to ensure that we have the policy and legislative groundwork to be able to move and grow the NHI program. And then lastly, Dr. Alta, I know I'm out of time, but I'm just going to wrap up with the future of NHI. Where do we see the program expanding to? Well, we like to think of it as a house. We've laid the foundation of our home. We've launched NHI in 2017, and we've been able to build health insurance infrastructure. We've then been able to grow the program to a critical mass. It was very important for us to have a significant number of Bahamians enrolled in the program. Then we implemented the Primary Care Transformation Initiative, and that's the stage in our development that we're in now. And we're leveraging the NHI model, the efficiencies that we've experienced in the almost 6 years since the program has been launched, to really catapult us to the next level. And we see that next level being NHI 2.0. I mentioned that earlier, high cost care. So we looked initially at a suite of benefits for the cancers that are prevalent in the Bahamas: breast, prostate, and cervical. Also end-stage kidney disease, dialysis, and a suite of cardiovascular conditions. And so when funding conditions are ripe and we're able to, the next phase in our development will be catastrophic care. But again, recognizing that in order to make that leap or get there, we have to strengthen our primary care transformation initiative, or the primary care lay-in country. And then lastly, we continue our journey to universal health coverage, incrementally expanding our benefits over time to ensure that we're able to sustain them. And so with that, I thank you for listening to me. And Dr. Lalta, back to you.